This is Alex O'Brien, reading abstracts for medical terminology. Deep cerebral venous sinus thrombosis often presents with neuropsychologic symptoms. From the Journal of Clinical Neuroscience. The outcome of cerebral venous sinus thrombosis depends on rapid diagnosis and initiation of effective anticoagulation. We report 7 cases of a subgroup with deep cerebral venous sinus thrombosis, DCVST, treated in our institution since 1990. 6 of our 7 patients presented with early neuropsychological deficits, mental obtundation, bradyphrenia, or apathia. This clinical presentation, in combination with headache and focal neurological deficits, aids the early diagnosis of DCVST. Thalamic hyperintensities on T2-weighted MRI images, previously considered infarctions, were fully reversible during treatment with heparin. This indicates that early in the course of the disease, they correspond to vasogenic edema. Clinical features of late-onset psoriatic arthritis. From the journal, Experimental Gerontology. The aim of this work is to compare the clinical and radiological manifestations of patients presenting late-onset psoriatic arthritis, PSA, with early-onset PSA. Clinical, laboratory, and radiographic signs were assessed. Of the 96 patients studied, 84 had their earliest symptoms before the age of 60, Group 1, and 12 after it, Group 2. The clinical forms of PSA observed were polyarticular, 6 patients, oligoarticular, 4 patients, and spondyloarthropathy, SPA, 2 patients. Only 2 patients had asymmetric sacroiliitis, and 3 had history of dactylitis episodes. In conclusion, we found distinct clinical manifestations in late-onset PSA. Peripheral affection was found predominant.